In part 2 of movement, we're going to pick up where we left off with really the examples of how the muscle spindles and then how the Golgi tendon organs are informing us about movement and positioning of body. And I'm going to just start that completely over because one of the classes didn't get to it and the other one we stopped in the middle. Okay, I'm going to try and walk us through this picture. I found this really helpful. I think this is from Neil Carlson's textbook on physiological psychology. And I'm just reminding you up there that the muscle spindle, the different kinds of proprioceptors, muscle spindles that are really stretch or length detectors and are running along parallel to the muscle, and then the Golgi tendon organs, which are detecting tension and telling us about the total amount of stretch that is exerted. Okay, so in A, and you can do some of these things, so eventually I'm going to ask you guys to do something like juggling or throwing something up and down so that you're catching it. But right now, you're just going to kind of pretend along with me, hopefully. So if you are holding your arm kind of just straight in a right angle, like in the picture, and then we move our arm down. Okay, so that's we're just passively lowering the arm. What's happening is you can see the muscle spindle 1 is one kind of muscle spindle that is running along parallel, and it is now starting to fire faster as that muscle is being stretched. Muscle spindle 2 is not really responding to that, and the Golgi tendon organ is also not responding to that. The Golgi tendon, organs in this case. So in all cases, because they're at both sides of the muscles. Okay, now we're going to drop our arm more rapidly or abruptly. And so now we see as I drop my arm rapidly or abruptly, muscle spindle 1 is going to start firing similarly as it did before because it is just receiving information about the stretch of the muscle. Muscle spindle 2 is going to now respond in a burst at that abrupt kind of drop. Okay, that sudden change. And again, the Golgi tendon organs are not changing because there's no difference in the tension. And so now we're going to have our arm at a right angle, and we're going to drop something into our hand that has some weight to it. And that's going to lower our hand for a second as we kind of have this response, especially it depends on the weight. We have this response where our hand goes down a little bit and then comes back up, okay, to where it was before. And so we're back at a right angle. And what we see, muscle spindle 1 is having that same kind of response to the dropping of the arm. And then as we reach it back up to the right angle, it's going to go back to what I assume is like spontaneous firing. It's not really responding much. Muscle spindle 2 is going to respond to when the weight is added when we drop our arm, and then we move our arm back up into position, and then it goes back to its spontaneous firing. And now the Golgi tendon organ, we have that weight dropped, and that tension that is on the muscle is going to cause that to fire, and it's going to continue to fire because we're still holding the weight. And so the exact stretch of the muscle is not what's so important there as it is the tension of the muscle. So the proprioceptors are providing the brain with information. And again, you can try the demo. I'm going to continue to suggest that every time he has this little box that says try it yourself, those are really great things to try so that you are applying this to something in real life and not just reading the scientific, yes, this is what's happening. But it's hard to find the appropriate tools for this, but if you can, you find something that is small and dense or heavy, and then something that is larger but lighter and less dense. And you have somebody drop the small heavy object, and you have this kind of compensatory response to that. And then as you somebody drops the larger object after the smaller object, you have this expectation for a larger kind of compensatory response, but it feels different. And really, your proprioceptors are telling you about that difference and about that experience. I also use the example of Ian Waterman oftentimes to talk about the importance of this information coming to the brain. So Ian Waterman had if I remember correctly, he was working for a butcher. He was very young, and he had some kind of flu or fever that, for whatever reason, it caused this problem where his autoimmune system attacked that medial lemniscal pathway. So he could no longer feel the touch on his body, and he could no longer feel the information coming back from these proprioceptors. And he was, luckily, still able to perceive pain. So I didn't actually talk when we talked about pain, but sometimes I remember too about people who don't feel pain, but it's really dangerous, as they're not going to feel when they're getting frostbite, or when they've broken an arm, or when their appendix bursts. All of these things that really pain is telling us to avoid. Continuing to hurt ourselves, or to move some arm that is broken, and so forth. So he could still feel pain. So in a way, he was kind of lucky. But when you read about his experience, you realize how really disturbing this would be. Okay. First of all, he worked at a butcher's, and he could no longer work there, as there's just too much danger around for somebody who can't really feel their body. But he would discuss things like, talk about how lying in bed feels just like floating in space. And what he learned to do was to monitor his movements and himself through eye movements, through looking around to figure out where he was, because his body wasn't giving him that information. And so there is a story of him being caught in an elevator that breaks down for a little while in the dark, and just crumpling to the floor, because without that visual information, it was just he just doesn't know where his body is or what it's doing, and it was just overwhelming and upsetting to him. So he just kind of crumpled to the floor. So yes, our proprioceptors give us really important information to tell us about the movement of our body, the tension on our bodies, and so forth. Your author has this section discussing units of movement, where we're going to distinguish between voluntary and involuntary movements. So where those reflexes, as I was just talking about, the patellar reflex, are involuntary and largely involuntary. I sometimes use the example of if we touch something hot, we have this kind of reflex, and to, again, a large extent, that's an involuntary movement. But we can have brain activity affecting this. So for example, I usually use the example of holding a casserole dish. So if I'm pick up my casserole dish and it's kind of hot, it's kind of burning my hands, it's really too hot. I don't want to drop it, right, as I'm carrying it to the table, as I'd break my casserole dish and ruin my dinner and all that stuff. But I can inhibit that reflex. There are reflexes that we simply cannot inhibit. So the patellar reflex is one, which is why they use that as a measure of the nervous system activity, and to make sure that we are neurologically sound. And so most of our movements are some mixture of voluntary and involuntary components. So as I'm starting to walk, as I start that first step, it's a voluntary kind of thing, but we already start this kind of mixture of these involuntary components of what is kind of this natural walking, as we put down the one leg, we just lift up the other leg, and it comes back down. And there are also the involuntary components of, as we're walking someplace, for example, I usually use the bricks at USC, where we are making these compensatory movements so that we're not kind of tripping over ourselves as we go too far or not far enough in one place, because of the weirdness of how the bricks are. Our body has these reflexive kinds of compensatory movements that we're really not very aware of. But even just the movement of the legs is largely, once we get started, largely reflexive. He also discusses here reactions from spontaneous activity, or explains the differences between when we're reacting to something versus having spontaneous behavior, which we'll discuss a little bit again when we talk about Parkinson's disease, as the basal ganglia are really important for this initiation of spontaneous behavior. But so he talks here about Westerns and gunfights and how usually it's the bad guy, okay, the quote bad guy, who is starting the gunfight, and then the good guy draws faster and shoots the bad guy. This is our old Westerns used to work. And you might wonder if how realistic that is. And he's basically arguing that it is kind of realistic. So they've done research to look at this kind of spontaneous behavior versus reactions, where they were watching people who, oh, I'm going to forget the study, where they either do something with their right hand or do something with their left hand, and whatever the one person starts, the other person is supposed to mimic. And it's up to the two people whether or not they are the starter, the person who starts. Well, it looks like the person who is reacting to the other person, so not the one who's initiating that spontaneous behavior, is approximately 9% faster than the one who is initiating the spontaneous action. So it does work out for our old Westerns if you're into that kind of thing. I almost always include my infant reflexes here, partly because I really like to show pictures of babies. I don't come off as a very warm person I think very often, because I kind of have a lot of material to go through, and it's this really scientific kind of material. But here we have babies, and we're going to see a number of reflexes here that we are born with that we lose in those first few months. Okay, so one is the grasp reflex. If we put something into a baby's hand, like our finger, they are going to have just this reflex of grasping that. It looks like this was particularly helpful when in our ancestry, that monkeys would grasp at their moms. And if we strike along, so then B shows the Babinski reflex. If we kind of move our hand or put our hand on the sole of the foot, and especially if we kind of strike forward, strike up, we're going to see this Babinski reflex, where the small toes fan out and the big toe goes in the opposite direction, as they kind of just have this reflex. Both of these don't really work on older people. Okay, if you do the Babinski, so you strike along someone's foot, it's probably going to be ticklish, and they're going to pull it away. And mostly if you put your hand on, if you go ahead and just put your finger to someone's hand, they might think you're weird, but they don't have this kind of grasping reflex. Interestingly, that is so something. These are things that we learn to inhibit. I mean, we lose them in the first few months of life, but it looks like we're learning to inhibit these. And so if you have somebody who you think maybe has had way too much to drink, you might try putting something in their hand, and you can see that they will have this reflexive grabbing of whatever that is. And that is, then you should definitely take their keys away, and maybe really look out for them, because they're in trouble. Another thing we are born with is the rooting reflex. So if we touch the side of a baby's cheek, they have this rooting reflex of moving their head to that, and actually whatever. So this would probably be the next thing, is the sucking reflex. Whatever, if that thing is still there when their mouth gets there, they're gonna have a sucking reflex as well. And this is apparently helpful for finding the breast and then sucking and getting milk. So we have these ballistic movements. Most of our reflexes are ballistic movements, which is a movement that's executed as a whole, not corrected by feedback. When I've talked before about those saccadic eye movements, those are ballistic movements, and you can think of them as a ballistic missile that once it goes off, it just goes to wherever we targeted it in the first place, as opposed to some kind of missile that can follow and find, as I'm waving my hands back and forth now, that's not so ballistic. Many of our behaviors or movements consist of rapid sequences. So when we're writing, speaking, dancing, they are these rapid sequences of movements. Some of these sequences, depend on central pattern generators, where we send the message from our brain to the spinal cord, and then neural mechanisms in the spinal cord then generate this rhythmic pattern of motor output. I typically think of this, so sometimes if you have a more ballistic kind of way of typing, like I do, and so when I write the word people or type the word people, I type it P-O-E, P-L-E. I'm not sure how that ever started, except that my right hand must be faster than my left. And now I'm very grateful that Word and PowerPoint and all these things automatically correct that, because I would have to go back and correct it every time. And I can't seem to train myself out of it. It would take lots and lots of practice, because again, I think it's just that my right hand is moving faster than my left. But you might notice some of these same kinds of things that you feel like once they kind of start, you don't really control them, and it's a whole pattern of a sequence of movements. And although a stimulus can activate a certain pattern generator, it does not control the frequency of the alternating movements. And I usually ask here for examples from the class, and whether or not I handle, yes, that sounds like a central pattern generator or not. Sometimes I have to say, as to what people's guesses are. So I think the example, if it's not in your textbook, it's somewhere in one of these textbooks, is of cats scratching themselves. So once they go to scratch themselves, that frequency of movements, that is that itch information, and the fact that they're going to scratch gets sent down to this pattern generator, and that frequency of the alternating movements is just kind of, it just goes. Okay, and we can have a motor program, which is a fixed sequence of movements, and we see this in mice when they do that cleaning of themselves, that they do this. I can't remember the exact, but lick, 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 and then they pull their paws up and wipe, wipe, and then come back, lick, 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 wipe, wipe, and so this whole kind of motor program is going, and we see evolutionary influences on these motor programs. I think your author uses the example of birds that don't use their wings to fly, but it's not that far back in their evolutionary background that they will use their wings. So I think he talks about dropping a chicken, and that even though it's not going to fly, it's going to flap its wings. Whereas other birds, where that's farther back, the ancestry of the flying birds is farther back in their evolutionary background, so far back that they no longer use that flight mechanism. So somebody apparently dropped something big like an ostrich. I can't remember if it was an ostrich or an emu, but dropped one of these bigger birds, and they don't do that same kind of flapping. And Fritsch and Hitzig back in 1870 discovered that electrical stimulation of the primary motor cortex will elicit certain movements, and usually this was just kind of a movement of an area of the body. The motor cortex is not sending those messages directly to the muscles. Okay, its axons are extending to the brainstem and the spinal cord, which are then generating the impulses that control the muscles. So the cerebral cortex is involved in complex actions like talking and writing, or these really more voluntary, complicated motions. It's not involved for those really reflexive actions that are simpler, like coughing and sneezing and laughing and crying. So some of those are coming from so I know coughing and things like that, sneezing, are coming from the medulla. Okay, so here's our picture of the brain, and I'm going to talk about a few of these regions that are being shown here in different colors. One is the primary motor cortex there in red. If you remember, it is just anterior to that central fissure or that central sulcus, and it has that same kind of body map, so the homunculus that we see in the somatosensory cortex. It's really similar, just slightly different in the motor cortex, and again, this makes a lot of sense for the fact that I want to feel my body and use that information quickly for these kinds of reactions to somatosensory information. But I'm also going to end up talking about the supplementary motor cortex, which is there in orange. I'm pretty sure I show this picture again every time I switch motor cortices. The premotor cortex, which is shown there in blue. I think I might even talk about Broca's area, which is over there on the left-hand side. And then a tiny bit about the prefrontal cortex, and even a tiny bit about the information coming from the parietal lobes as we have intentions to make certain movements. But I'm going to start here with the primary motor cortex, that strip of motor cortex at the very posterior part of the frontal lobes. So in the cerebral cortex, the primary motor cortex we discovered, or Frisch and Heatsek discovered that if they stimulate in the primary motor cortex, that we see it affects a certain part of the body. We can go and look at that homunculus, which actually I think that was still mapped up by Wilder Penfield, just like the somatosensory cortex is my memory. I probably should go look that up, but that's my memory of how that was mapped. So we figured out the mapping of that. But what they were doing was these short bursts of stimulation that were getting us to see, well, if I do that here in the left area, where in the last slide we saw the thumb, then that's going to make the thumb twitch. But in 2002, Graziano, Taylor, and Moore went in and they compared. They went and looked at a monkey, and they compared 50 millisecond stimulation time with 500 millisecond stimulation time, where now we're talking about a good half second of stimulating some neuron in the brain. And what they found here was a complex pattern of movements. Okay, so I'm going to use this one, the monkey up to the sort of the top left there, reaching to grasp. So somewhere in the left primary motor cortex, down there kind of near the hands and near the hands and fingers, we're going to see this 500 milliseconds gets the monkey to take its right hand and reach to a certain place and grasp. What they also found was that repeated stimulation to that same spot ended up in the same result. Okay, so if they're reaching up in this particular part of the right hand space, that regardless of where the hand starts from, the original hand position, the monkey moves the hand in the right way to move up to that part of space and to grasp. Okay, so the outcome, the outcome is not specific muscle movements, it's a particular goal that is occurring, or a particular outcome of where we want that movement to go. Okay, I'm going to move back to the posterior parietal cortex, which on this brain is being shown in the kind of purpley color. And so remember, we have our somatosensory cortex up there at the anterior part of the parietal lobes, and our visual cortex in the back. And it's really, so what's happening as we go up through that aware pathway, dorsally through the parietal lobes, we are we're becoming aware of our body position, especially relative to the world and objects in space, so that we can navigate in the world, which is why this is sometimes called not a where pathway, but a how pathway. And in 2009, they did a study where they stimulated this posterior parietal region, and what people reported after stimulation, so this was one where it was people who were getting ready for a surgery on the brain, and so they'll have the scalp open and the brain exposed, and they can go in and talk to the people, as we don't have pain receptors in the brain, and we can ask them questions. And so they would stimulate, and the people would report that they had an intention to move when we stimulated this posterior parietal cortex. They stimulated that more intensely, and the people reported actually having moved. Okay, they actually had not moved, but the intention was so strong that it felt like they had moved. And this region of there is a part of this posterior parietal cortex that is called the parietal reach region, because it's part of our intention and plans to reach